What is the best treatment for under-eye wrinkles, fine lines under the eyes? I am 29 years old and have had fine lines, wrinkles under my eyes since my early 20s. These lines have increased and deepened over the last couple of years and are really starting to bother me as they make me look much older than I am. I use SPF daily and have been getting regular Botox since I was 24. I've tried it under my eyes but haven't noticed much improvement. What is the best way to significantly improve these lines? If it's laser resurfacing, which laser is best? Please be specific. Does skin pen work?
Thank you for your question. You're 29 years old and you submitted two photos of close-ups of your eyes, one at rest and one with expression. And you stated in your question that you've been doing Botox since you're about 24 years old, and you're asking about what's the best way to improve the lines under your eyes. And if it's a laser, then you're asking for a specific answer. And you're asking also about a commercial microneedling device. Well, I can certainly share with you my approach to developing a treatment plan for patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people improve the appearance of wrinkles around their eyes is something we do all day long in our practice every day. So, in the absence of both a more in-depth history and a physical examination, I'd start by first inquiring, when I see someone who is young like yourself, as to what are some of the potential causes of this degree of wrinkling, which is, from my experience, greater than what I would expect from someone who's young. And usually, or often, there is a history of excess sun exposure, maybe a history of the use of tanning beds consistently and extensively, as well as the smoking history. And of course, I'd also ask about medical history and other issues, as well as the genetics of these types of wrinkle issues in the family, in terms of ethnic background. People who tend to have lighter skin tend to have fine lines and wrinkles at an early age, as opposed to people who have darker skin types. Now, that being said, I'd also look into other medical issues, whether it has to do with diet, with its medications, and other factors that could be contributing. Also, allergies. I'd look into whether a person has extensive seasonal allergies and other issues that can cause an issue with eye swelling and eye rubbing. Now, that being said, the point of asking those questions about history, if there are variables that I can do something about in terms of guidance and what to do or what not to do, that also helps. Prevention is very important, and certainly you've been doing that by doing Botox to try to minimize the muscle activity that's causing the fine lines and wrinkles to occur. Now, to share with you my general approach, again, looking at someone who is young and with the tools that we currently have. The point of your question as far as technologies are concerned is, what do the technologies do to help improve wrinkles? Well, when you think about wrinkles, you're thinking about essentially one major issue, which is loss of support in the skin. And the support in the skin is generally focused on one major protein called collagen. Now, collagen is important, and all of the devices that are very openly and aggressively marketed, whether it's a laser, thermal energy device, or a microneedling device, is all focused on induction of collagen. Well, I would also say that one of the things that we have to be mindful of is degree of trauma and the consequences of that trauma, not only short-term but long-term. You see, doing this for over 20 years, I have gotten to see the results of very aggressive treatments on patients as they age. And I would say that when a treatment is very aggressive, the skin can actually become thinner. And that is something that I would caution you about. A lot of times people believe that a more powerful laser, a more aggressive microneedling procedure, or a very aggressive thermal energy device, such as a focused radiofrequency ultrasound, is a good thing because it'll induce maximum collagen. But there is a balance there, and sometimes you actually cross a line and you actually accelerate collagen breakdown. So I would tell you that in my practice, what was always been essentially the gold standard to help with under eye wrinkles for lighter skinned individuals has been some kind of laser, whether it was an erbium laser or whether it was a CO2 laser. At the current time, I would, in a situation like yours, probably, again, without the benefit of a history and physical examination, I would consider doing something like a fractional CO2 laser so I can get the benefit of collagen induction as well as some thermal contraction. Now that's different from microneedling, where microneedling is causing a collagen induction. However, the thermal element of that is not there. But I would also suggest the use of something called PRP. Now, PRP is platelet-rich plasma. Now, this is derived from your own blood, and it is a concentration of the wound healing growth factors and elements that help stimulate collagen. And the reason why I use it a lot, and I've been doing this for many years now, is that with that goal in mind of stimulating collagen and understanding there's a line and limit when it comes to different devices, when you're talking about PRP, you can inject PRP under the skin and do it with regularity with no fear of a negative consequence related to a device where skin is being heated. In other words, you're looking at the foundation of the skin being improved, and you can constantly do that. You can't keep doing lasers over and over. You can't keep doing microneedling beyond a certain level. The same thing with radiofrequency. Basically, those treatments are essentially to treat and then wait and see how your body responds. Well, we've learned a lot in our practice in the art of balance, where you can use a thermal energy device like a CO2 fractionated laser to help resurface some of the skin as well as induce collagen induction, I should say, and at the same time minimize and narrow the risk so that you don't have to be overly aggressive, because then PRP complements the goal of the process in inducing collagen. And then we can do that with consistency. The thing about the strategy, and any strategy in cosmetic dermatology, is that you have to have a little bit of understanding of the concept of observation. You treat and you observe, and then you further you make decisions based on the skin's response. A lot of times, whether it's non-physicians or med-spas, people get locked into a treatment schedule, a protocol, a process, something that doesn't involve a lot of thinking. But I would argue that a physician who understands this and is thinking about this more critically with a greater depth of knowledge and experience, you can actually have a more customized approach. Now, of course, the Botox would also play a very important role in terms of the ongoing maintenance. So I recommend you meet with qualified, experienced doctors who do this type of work a lot and learn about this strategy of using a device that stimulates collagen in conjunction with PRP. I think that from my perspective, that would probably be a good strategy for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.